nothing's going on. We'll be fine.
In medical news, aortic valve replacement is traditionally performed through open heart surgery, which is particularly dangerous for elderly patients, many of whom are ultimately deemed too high risk for the operation. Now there's the transcatheter aortic valve option, known as the core valve system. IBA's Laura Kornfield asked Professor Chaim Dannenberg about the procedure.
It's a fascinating new technology for the implantation of heart valve, saving us the need for an open heart surgery. It's a procedure that is done totally percutaneous, in btzintור, which means we go through a minor puncture, usually in the groin, and insert our catheter, which carries the valve, which is miniaturized. And once we reach the right place in the orifice of the heart, we release the valve, it opens up and starts to function, replacing the sick valve, the valve that is not functioning. The disease, aortic stenosis, is a disease that occurs quite often in the elderly patients above 70 and 80, causing shortness of breath, chest pain, syncope, and ultimately cause the death of the patient.
The core valve is safer for patients of that age, is it not?
And core valve appears to be safer than surgery, than open heart surgery. And these are the results that we've been seeing in the last study, the study that was published just a few weeks ago.
What's new about what you're doing right now? You first operated using the core valve in 2008. What's new? Why is only now in America the FDA starting to approve the use of this procedure?
Because when we started, the procedure was actually saved for patients that cannot undergo surgery or has been shown to be at a very high risk for surgery. Now, after this study that was conducted following FDA regulations, we learned that the procedure, the non-surgical procedure, the core valve, is actually more effective and safer than open heart surgery. And now the FDA approved this for commercial use in the US.
What was the scale of the research you conducted and who was involved in it?
It's a very large study. 45 centers, medical centers, hospitals in the US took part in this study, and over 750 patients were recruited and were randomized to either surgery or to core valve implantation without open heart surgery. And what we learn is that at 30 days and at 1 year after the procedure, mortality or death in those patients that underwent core valve implantation, the death rate is much lower, significantly lower than the one seen following surgery. And we should mention, surgery is a very effective therapy for this disease, and the results of the surgeons were outstanding. Nevertheless, core valve implantation was even better, safer, reducing mortality, reducing death rate.
And it's now received approval by the FDA and will go into use in the United States?
Yeah, and now it received approval in the US for the use in patients that are deemed at high risk for surgery. And we are all awaiting new studies that will show how effective it is in patients that are even at lower risk for surgery. Because as it seems now, this would probably replace surgery in the coming future in all patients, even those at intermediate or low risk for surgery.
This week of national introspection that culminates with independent